The imaging has really made a big difference in the types of surgeries we can do. And I would actually say that it's really accelerated the move towards minimally invasive spine surgery because with the imaging quality, we're able to really plan out our surgeries to a higher degree of detail than we could before we had these technologies. So with these imaging modalities, we get these scans. Some of them are three-dimensional. For example, if I'm doing a big scoliosis case where somebody has a curvature to their spine that we're trying to correct, well, we can actually print off a 3D model based on their imaging that I can then study before the surgery. I can plan exactly the type of operation the patient needs, and then even bring that into the OR with me and use it to execute the plan. And it really does help bring about personalized, tailored care whenever you can have that level of detail in your imaging and in your planning too. In the bad old days, they used to have to make these very long incisions in order to make sure that they were operating at the exact right part of the spine. Okay. Nowadays, we essentially have GPS for the spine. And so think of your Google Maps or your GPS system that tells you exactly where to go. Well, we have technologies very similar to that in the operating room, where we have a camera that's registered to the patient, and then we project the patient's anatomy from their imaging onto a screen, and then we can use an instrument to essentially know exactly where on the body we are just by looking at a screen. Those technologies are things that I use every week for the vast majority of my surgery. We call it neuronavigation, and it's something that we're really lucky to have here at OHSU.